Meryl. I'm Anne. I'll be your nurse today.
This is my friend, Robin Cradles.
Robin, nice to meet you.
She's
Nice
my
to meet
spiritual life coach.
We are always together. Nice to meet both of you. What brings you in today?
We're here to get more information on my meds.
Oh, absolutely. So it looks to me that you've been prescribed misoprostol for your heartburn.
Yeah, she told me to take it, but she also told me I need to get on birth control. What does heartburn have to do with sex?
Good question, and we'll get to that in just a second. But first, I'd like to talk to you about your use of Aleve for your lower back pain.
Yeah, I use Aleve a couple times a day. Usually when I wake up in the morning and then again at night.
Oh, have you ever thought of trying other methods of pain control?
No, not really. I do physical therapy a few times a year when the pain gets really bad.
Okay, that's a good start. So just a little background here. You say you're a smoker?
Yep.
And you say you drink fewer than 2 drinks a week?
Yeah, I've never been much of a drinker.
Do you have any history of liver disease?
Nope, liver's in good shape. My poop's brown.
There we go. Would you ever consider trying Tylenol instead of Aleve? There's an extended release formula that might be effective for you, and it might eliminate the need for the misoprostol that your PCP has recommended.
Wait, why would that be?
Well, because naproxen, which you've been taking, Aleve, is pretty rough on your GI tract. It can cause ulcers if you use it too much and too often. So it may even be that your use of Aleve has contributed to your heartburn. If you do choose to switch to Tylenol, make sure to really watch your alcohol intake, because Tylenol used at the same time as alcohol can cause damage to your liver.
Wait, so you're saying that the Aleve could be causing her heartburn? You could give Tylenol a try, right, Meryl?
I would give it a try.
Wonderful.
Great. Well, that's a great progress. Well, in the meantime, your PCP is suggesting that you take the misoprostol for your heartburn. Are you familiar with the way that drug works?
Nah, girl.
Misoprostol works by reducing the amount of acid that's produced by your stomach. And it has been effective in treating heartburn, but it also has some effects on your cervix. And because of this, it can cause a spontaneous miscarriage. And that's why your doctor said you need to be on a reliable form of birth control if you're going to be taking misoprostol.
Oh man, I mean, I'm not trying to get pregnant right now.
Yeah, we've decided this wouldn't be a good time for her right now. The baby would be born a Sagittarius. That's not ideal.
I understand you're not trying to get pregnant, but without reliable birth control, accidents can happen.
Yeah, man, I mean, I've got different bros in different area codes.
And we think that's very healthy. It's important to have frequent orgasms to nurture the soul and feel connected to the universe. Right, Meryl?
Right you
are. What birth control method are you using right now?
Oh, just condoms and whatever spermicides they got down at the Jubits. The doc won't let me have the pills since I smoke.
I track her cycles religiously. I've matched them to the lunar calendar. Tomorrow is a full moon, so I know she'll be ovulating. It's worked for us so far.
Well, your method seems like it has worked so far. In case you're wondering, the reason that it's recommended that you don't take birth control pills is that pills that contain both estrogen and progestin is because you have some risk factors that would make it more likely that you could develop a blood clot, which could travel to your heart, lungs, or brain and be really dangerous for you.
Oh, what risk factors?
Well, she's over 35, and you said you smoke cigarettes, both of which can increase the risk of a clot. Also, your job as a long-haul trucker means that you sit still for long periods, and that is actually another risk factor as well.
Oh, I see. Well, I wouldn't want to take anything that would be giving me a clot.
Also, we think it's very unnatural to take something that contains so many hormones, especially ones you have to take on a schedule. We let the sun and the moon guide our decisions, not some arbitrary man-made clock.
There are some other options for you for highly reliable forms of birth control, like an IUD or Depo-Provera, which is an injection of progestin that you get every 3 months. Since it sounds like you want a hormone-free method, I would suggest the copper Paragard IUD.
What's that?
Well, the IUD is a small T-shaped device that is inserted into your uterus. It acts to irritate the uterine lining and prevent implantation of a fertilized embryo. Copper is also a natural spermicide, which is an added benefit.
Oh my god, I read about this. In the olden days, the Bedouins would put a tiny rock in the uterus of their camels to prevent their camels from getting pregnant. This was a wonderful alternative to chemicals. I think we love it.
I'm glad we found something that should work for you. And remember, the IUD will be put in place to prevent a pregnancy, but you should still continue to use condoms to protect yourself against sexually transmitted infections.
Coolio. Use condoms. Got it.
Before you go, too, I'd like to talk a little bit about your pain management strategies. Right now, you're managing your pain with Aleve, and I've suggested that you consider switching to Tylenol because it's going to be less irritating to your GI. But I also wanted to mention that there are a few non-pharmaceutical pain management methods you can try as well.
I've been trying to talk to her about meditation. We tried guided imagery, crystals, but she didn't find much relief.
How about trying yoga or other core strengthening exercises? There's lots of evidence that these activities can be helpful for chronic low back pain.
Robin said I should try yoga, but we're always on the road, so I can't go to classes.
But, I mean, it's a concern, but there are books and DVDs available that would let you do yoga anywhere.
I'll always be there to guide you, Meryl.
If you're able to manage your pain with yoga, you might not have to take your pain medications, which could actually potentially decrease your need for taking misoprostol for your heartburn.
I'd definitely be willing to do that. I also could take a look on Amazon Prime, see if there's any ergonomic seat cushions for my big rig.
That's a great idea, my beautiful Phoenix.
Do you have any other questions before we say goodbye?
Nah, girl, I think I pretty much got it. I know I need to make an appointment to get that copper camel thingamajig put up there before I start taking misoprostol. I don't want to have a miscarriage.
Good, yeah, absolutely.
And instead of the pill, and I mean, it's a better alternative than taking the pills. I don't want to have a blood clot either.
Yeah, absolutely, I agree.
And we should find you some non-medical ways to treat your pain, and of course, align your chakras.
All right. Before you leave, I know you've heard this a million times, but I really need to suggest that you try to quit smoking, or at least cut back on it.
How am I going to get my nick fixed? I'm just kidding. I know it kills. I should probably stop smoking.
We have an appointment with a hypnotist next week. My cousin went to one to lose weight. She's as skinny as a willow branch blowing in the wind on a summer afternoon.
That's wonderful. I'd also like to give you this pamphlet about other ways to quit smoking. It includes information about the nicotine gum if you're concerned about that, and the nicotine patch as well. So hold on to that,
Thank you.
just in case the hypnotist falls through.
Thank you for all your help today.
Thank you for all your help.
It's been my pleasure, ladies. Thanks for coming in. And check in with the receptionist on your way out, and she can set up an appointment for you to get that IUD inserted.
Okay, sounds good to me. 10-4, good buddy. Adios.
Adios.
Blessed be Mother Earth.